to Midday Kentucky, everyone. Of course, we have Dr. Eric Smith, General and Bariatric Surgeon from Georgetown Bariatrics and Advanced Surgical Services. Welcome back to the show, my friend.
Thanks.
Now, we're talking about all the weight loss systems that you do over there at Georgetown. What I wanted to talk to you about is adjustable gastric banding to begin with, because you offer 4 different types of procedures, am I right?
Correct.
Okay, so let's start with that one first. Tell me about it and how does it work?
So laparoscopic adjustable gastric band is basically what we call a restrictive procedure. It's a procedure that's fairly quick, takes about 30 minutes to do.
Oh, wow.
And you place basically a silicone band around the top part of the stomach that has a balloon on the lining of the band, and it's connected to a port that sits underneath the skin. Nothing's on the outside of the patient.
Okay.
And by placing fluid in that port, you can tighten or loosen the band to help patients with weight loss.
Half-hour procedure, that seems like it's minor when compared to other processes.
Sure,
it's
it's almost always an outpatient procedure unless an insurance requires a stay, but it's by far the quickest one that we do.
Okay, Roux-en-Y gastric bypass.
So Roux-en-Y gastric bypass is a procedure that we do laparoscopically or robotically. It's probably the one procedure that we have the most long-term data on. It's been done a long time.
Yeah.
This is one of the bigger procedures that we do, and what it does is it creates both restriction and malabsorption. So that's the two modalities that help the patient lose weight. So we create a very small gastric pouch to cause them to feel full quicker, and we also bypass a portion of the small intestines so they only absorb a portion of what they take in. And those two things combined is what helps them lose weight.
Okay, so the next one we're going to talk about is the vertical sleeve. How is that different from the other processes?
So the sleeve gastrectomy is something that we do robotically. It is a minimally invasive surgery just like all the other ones. It is only a restrictive procedure.
Right.
So we basically take the stomach and we reduce it down to about the size of a banana.
So you're basically cutting it in half.
Exactly. We're removing the part of the stomach that stretches. I like to tell people normally your stomach is like a water balloon. You put it on a faucet, it's going to expand 10, 15 times its size. When we create a sleeve, we remove that distensible part of the stomach, and now it's like a long, narrow tube. And when that fills up, it's full. It does not stretch or distend.
Wow. One of the things that I've seen us talk about here before is the gastric balloon.
Right.
I love the look of how that works.
Right.
Tell us a little bit about that.
So this is a newer procedure that was recently FDA approved in the United States a little over a year ago. It's been around in Europe for some time. This is a temporary procedure. This is for patients with a lower BMI, a BMI between 30 and 40, where we go in and endoscopically with a scope place a balloon inside their stomach, which just creates occupation of the space in their stomach, makes them feel full quicker, and it gives them the impression of feeling full kind of all the time.
Okay.
And we teach them portion control with that. That balloon can stay in for 6 months. At the end of 6 months, then it's removed, and it's removed endoscopically.
Interesting.
It takes about 10 minutes to place it and takes about 10 minutes to remove it. But it's really for that lower BMI patient that maybe is not ready to go to something permanent and wants to try to use this as a tool to learn how to portion control.
Okay. Now, people sitting at home, we've just given them 4 options. How do they know, watching you right now, which is the right one for them?
Well, I think, obviously this is a quick summary of what we do. I think the first thing that they would want to do is go to our website and do what we call an online seminar. They can come in person. We do them once a month at the hospital and do the same thing. And then we will talk in detail about each surgery and procedure, risk, complications, outcomes, how much weight they can expect to lose. Most people have done a lot of research and kind of have an idea of what they're interested in. But once they get that information and they come visit us, then we're going to look at their medical history, look at the surgeries they've had in the past, look at the things that they're struggling with, and really guide them to the right procedure for them.
Let's talk about the program fee. People at home would want to know, is there a fee?
No, we don't charge a program fee. I don't think that it's something to bring someone in that you should charge them just to have interest in your program, so we don't do that.
Information and education is key, is what you're asking people to come and sit with. Now, insurance covers these?
Insurance will, the first 3 that we talked about, many insurances will cover it,
Right.
including government insurances as well. Everybody's plan is different, and so it's very easy for someone to call the office, and in a matter of minutes, they can, with our insurance coordinator, say, this is my plan, and they can say, you do or don't have benefits, and this is the criteria. The balloon, because it's new, because we don't have as much long-term data on it, insurances are not covering it currently.
Okay.
So that would be a self-pay option by a patient.
All right. Well, as usual, incredible information. If you want to find out more information about Dr. Eric Smith, Georgetown Bariatrics and Advanced Surgical Services, he is the leader when it comes to these type of procedures. There's all the information up on the screen. Like he said, head over to their website. All the information is there. We appreciate you coming in again. We'll be